Good afternoon, everyone. We are about to commence day 2 of our conference on the governance of social listening in the context of serious health threats. So for those who are in the moot court, I invite you to return to your seats. Mention if you haven't got the headset already, please do help yourself to this. Okay, so welcome again, everyone. We are going to continue with a rich program today with specific focus on a number of jurisdictions, particularly starting with mainland China in the first segment, and then looking at Brazil in the following segment. We're very delighted to have a very distinguished panel, in fact, distinguished panels today, as we did yesterday. To start us off, delighted to introduce a very special colleague for both myself and for the Center for Medical Ethics and Law. That's Professor Vivian Lin. Professor Lin, as you see, has an illustrious CV that's set out in the conference booklet. She's also a board member of our center and has provided us with invaluable guidance over the years. So we're deeply grateful for all that she's done for the center and also for ourselves as scholars. So without further ado, well, actually, before that, I should just highlight that Professor Lin has had a very close working relationship with the World Health Organization and therefore speak with authority on a number of issues that we will consider in this particular conference. So that's an addendum to what I wanted to say. And with that, Professor Lin, it's over to you. Thank you very much.
Good afternoon, everyone. As I am actually at the moment acting Dean of Medicine, I'd like to just extend the warmest welcome to Hong Kong for our international participants. It's been really wonderful to see this collaboration between the law faculty and the medicine faculty. It's not always easy, as we know, doing interdisciplinary work, but I think just from the conversations yesterday, we could see how fruitful it is and how we all need to make time to have more of it, because this is where learning happens. And when we learn, we will also find solutions to the world's problems. But as Calvin has asked me to just say something very brief, from a health systems perspective, because I was the director of health systems in the Western Pacific region prior to coming to Hong Kong U. So let me reflect and perhaps be actually very critical of the way health systems work. So I think we firstly recognize that universal health coverage is what countries have all signed on to as part of the Sustainable Development Agenda. And at the heart of universal health coverage is equity and universality. Now, in the definition of UHC, it is about all people having access to quality health services without undue financial hardship. But having access is not the same thing as having a good experience in the health system and a service which is very people-oriented. And if you don't put patients, families, and communities at the center, you will not get trust. And trust is absolutely essential to access and continued engagement with the health system. So from that perspective, health systems need to listen. This is before we even get into social listening. Any listening would be a good step forward. Because I think that when we look at COVID, you know what COVID has illustrated, right? Is this problem across society, across the economy, the way countries interact with each other. But within the health system, it certainly has also pointed to the kind of gaps, the kind of fissures, the cracks in our health system. And one of the most important problems or lessons is really to think about how do we reach diverse populations, and reaching diverse populations and rebuild the trust in the health system. And if we did better, we should not see groups that were excluded from protective measures, groups that didn't have access to medicines, groups that carried the burden of infection in those societies. Extraordinary events of people being locked down without understanding why they were locked down. So we can all have stories from many countries. But COVID is not the only instance. It's the most recent, perhaps, universal instance. We could think about many other programs where the health system approaches it as one size fits all. There's a single model for immunization, for maternal and child health, for doing tobacco control. We think about it as a population-wide intervention. But when we do population-wide intervention, we miss the diversity. We miss the different needs of different communities. We have people who are still yet to be reached by various vaccines. We have instances where we have lowering of population level prevalence in tobacco control, but increased inequalities in use of tobacco. We have instances where we're almost nearing elimination of certain diseases, but there are certain groups that just have not been reached. And we really haven't been able to really engage at scale with the population on major threats like climate change or antimicrobial resistance. So that's a problem of not listening. Now, not listening is in part the way health systems work. Health systems, think about these chess pieces: money, technology, medicines, data, hospitals, health facilities. You don't often find people being talked about. Even health workers are seen as chess pieces you move around, rather than necessarily people. And the system tends to be largely reactive. When people front up, then something is done. There's an assumed technical expertise that resides with the professionals. And so it works in this very top-down fashion with an assumption that not only have they got the technical knowledge, but they also have the social knowledge. They know certain groups do not seek institutional delivery because, they're old-fashioned, they've got superstitions, whatever. There's any reasons, and I'm sure you all have examples of that. So this is a problem of not listening. Now, of course, we move into an era where we talk about social listening, which is yet another dimension. And that's, of course, all the more important in this age of social media and the bubbles that people live in, which are global. They're not just local, but these are global bubbles that people live in. So we've got a real challenge. On the one hand, how do we engage with diverse communities effectively? Because without building that trust, that understanding, the health literacy, we're not really going to deliver on universal health coverage. At the same time, we also know that in these bubbles, we have groups not only perpetuating falsehoods, but they may dress themselves up. When we think about the commercial determinants of health and the work of tobacco and alcohol industries. There are many there are front groups that are also doing. So it's a very complex social media landscape. And so that makes social listening, of course, very, very important. But whether it's just ordinary listening or social listening, I think with all listening, the methodology is very important, as is the interpretation, not to mention the governance, which is, of course, what is being explored at this meeting. Because if we only focus on certain types of media, or if we don't deal with it in terms of the multiple myriad of subgroups that are driving these conversations, we will distort our own understanding of what the world is like out there. Social listening can, if not done well, lead us, I think, into some false pathways and not giving us that full picture of whose voices are we missing, who is jumping up and down the loudest and needs to be managed. You know, we really need to have a good sense of the diversity of the people who are talking and not talking. So it's a message of please listen, health system people, but also be very aware, take social listening with the same rigorous methodology that you would take to any scientific research. Because if we don't listen equitably, we're still going to end up with a one-size-fits-all approach, or in fact, go off the rails. So that's it from me. Thank you.
Thank you so much, Professor Lin, for the wonderful words of wisdom. So equity, of course, remains one of the key focus in our presentations and discussions today, and also in the final day of the conference. We have addressed a number of aspects pertaining to equity and equitable practices in day one, and we hope that there will be concrete outcomes from the discussion in this conference, both academic and in terms of policy outputs. Thank you so much. In the interest of time, we will hear from our two presenters, Professor David Scales and Professor Joe Ali. They are, of course, speaking about, or at least in the context of the US. And then this will be followed by three presenters whose context, of course, will be essentially focused on Brazil. So I'm delighted, of course, to first of all introduce Professor David Scales. As you see, he is medically trained and he's from Weill, Cornell Medicine, that's based in New York. He has a very good combination, I thought, that the technical and more normative aspects and normative concerns that would apply or that would arise from the application of techniques like social listening. So it's a wonderful opportunity to hear him. I think for both our presenters, their credentials are very well set out, impressive, of course, both. And without further ado, Professor Scales, welcome. The floor is yours.
Thank you very much, Calvin. It's an honor to be here. One thing in my bio, if you happen to look at it, is so I'm a physician and I'm a sociologist. I spend a lot of my time translating between social science and medicine. I'm also a trained medical interpreter in Levantine colloquial Arabic. So I'd like to thank the in-person live interpreters. And my job today is what I see as trying to be a translator between event-based surveillance and what we're talking about with social listening. So that's my goal, hopefully, today. So, let's see. So what I'm going to go through, because I know there's a lot of jet lag in this room, my hope is that if you come away with anything from this talk, it's that as we're talking about ethical guidelines, I'm going to use the example of event-based surveillance to show that practical guidance is essential. Guidelines aren't enough. Accountability mechanisms are also, I think, very important as we're talking about the ethics of social listening. Because the trend toward event-based surveillance and integrated disease surveillance systems, what I'm going to be talking about today, it foreshadows, I think, some of social listening's implementation and ethical challenges and concerns. I'm going to talk about some of those concerns. I'm going to briefly touch on data acquisition and privacy concerns. I think Professor Cao examined that extremely well in the case of China. So I'm not going to spend a lot of time there. I'm going to focus a little bit more on definitions and power imbalances, and then thresholds for action amidst uncertainty. So briefly on definitions, I'm using the same definition of social listening that Calvin presented yesterday. So I just want to make sure that we all understand that we're talking about social listening in a broad context, not just the gathering of data and the monitoring, but the analysis as well of various different streams, both online and off. I'm going to be talking about event-based surveillance as well, which is the organized collection, monitoring, assessment, and interpretation of mainly unstructured ad hoc information regarding health events or risks which may represent an acute risk to health. That's a WHO definition. I'm also going to be jumping off from indicator-based surveillance, which is a surveillance approach that routinely collects and analyzes data from well-defined sources, usually healthcare delivery facilities, using predefined case definitions. I hope I haven't lost the lawyers in the audience. Please stick with me. My goal is actually to speak to you. So if you don't understand, I would actually really love to have your questions and your comments, because I think this is where we need to be having the interdisciplinary discussion. So I apologize for the language, but hopefully this will clear some of that up. Those definitions are important because I want to give a very brief history of emerging infectious disease surveillance. The international sanitary regulations from 1951 covered cholera, plague, relapsing fever, smallpox, typhoid, and yellow fever, 6 diseases. But that was only possible essentially because there was indicator-based surveillance, which are confirmed disease cases, or very much now we also incorporate kind of known syndromes like influenza-like illness. Indicator-based surveillance tends to be slow, but certain. In the international health regulations, there was a paradigm shift in 2005 that shifts priority to reporting based on risk of spread across borders specifically, not based on any individual particular disease, even though there are some specific diseases that are mentioned. But there's also a very important aspect of the IHR, which is the core capacity requirements, also known as Annex 1, which are the core capacity public health requirements for being able to detect doing monitoring and surveillance of infectious diseases so that you can report them via these mechanisms. And there were deadlines to meet those core capacity requirements. So the trend in general is that surveillance in public health is trying to find known threats earlier, as well as detect the unfamiliar as quickly as possible. And there's been a lot of infrastructure put in place to try to do that as efficiently as possible. What does that mean for social listening? Well, so if we separate event-based and indicator-based, we can see that they have slightly different objectives. Event-based is very focused on early warning. Indicator-based, it does some other functions, outbreak detections, informs response, monitors trends over time. They use somewhat different sources because the data quality is slightly different in each. As you can see, the evidence quality for event-based surveillance is a little bit, you don't know what you're going to get. But the idea is you're willing to take a certain amount of noise because the signals can be so important. So you're willing to really focus on gathering as much data as possible and trying to understand it. But indicator-based surveillance usually has higher quality evidence. Event-based tends to be faster. Indicator-based is more variable. And there's various responsible parties. Event-based surveillance, a number of different groups do it. In the United States, there's NGOs, there's academic institutions, but there's a lot of government institutions that are doing this around the world. Whereas indicator-based generally is almost exclusively kind of the health system and kind of the local, state, federal governments. So what is digital disease detection and event-based surveillance? So it's essentially trying to detect various different signals by collecting all sorts of data. So I appreciate Professor Cao's discussion about big data in the last talk. That's exactly what public health surveillance is trying to leverage big data to detect epidemics earlier and earlier. So it started off mostly with news, but it's all sorts of different data sources that are processed and then analyzed. And then that intelligence is turned into alert notifications. Now, the history of this is GFIN, the Global Public Health Information Network, was started in about 1994. But there's been a number of other organizations that have started since. GFIN is actually integrated within the Canadian government, very supported by the Canadian government, but that's not necessarily always the case. Medisys is based in Europe, but there's a number of these systems that, like HealthMap, which is actually where I did my postdoctoral research, that is external from any sort of governmental system. So event-based surveillance, it is looking for signals. And once a signal is detected, there's attempts to triage and verify those signals, and then those become events. Now, events are sometimes called events. They're also sometimes called alerts. There's also sometimes people actually call them signals. There is a little bit of lexicological ambiguity in these terms. However, that's actually one of the things I want to focus on. Because once you have an event, then you have to decide, are you going to do something about it? Right? And so then in theory, why are we doing this surveillance? Why do we care? Right? You want to do something, right? So then that precipitates an action. Now there's also increasing trends to move towards community-based surveillance, where people in the community are involved in the systemic detection and reporting of events of public health significance within a community by community members themselves. So these can be community health volunteers, religious leaders, community health workers, civil society members. So essentially, it's again on that trend towards trying to figure out different ways to gather data as close as possible to the ground so that you can integrate it into a public health surveillance system and make decisions based on that. So what does that look like, right? So you're getting data from multiple channels. On the top of this diagram, you're seeing essentially a indicator-based surveillance. These are kind of more official reports, case reports, syndromic surveillance, causes of death, laboratory reports. And on the bottom, you're essentially seeing the event-based surveillance. These are the kind of the less certain, but could be a signal type of data. Drug sales trends, school absence data. If there's a sudden drop in the number of students that are going to school, that might suggest that there's some sort of virus going around. Internet searches. So a number of different data sources that are integrated and analyzed in a cloud-based servers, attempting to try to figure out what are signals and what's noise. And I'll talk a little bit more about this in just a second. And then you're creating an iterative process that in this one paper talked about as a sustainable surveillance system, where you're trying to periodically assess the quality of the data that you're getting. You're then trying to strengthen health education to eliminate discrimination. You're trying to pay a little bit more attention to privacy protection, and you're trying to strengthen communication with stakeholders. But there's a reason why these, I would argue, ethical concerns are in the lower right of this diagram. It's because they're afterthoughts. You are setting up this system when you are doing event-based surveillance and you are trying to set up an integrated disease surveillance system. It is a technological problem, and the ethics comes second. So this is a concern. It's also a concern because there's been an aggressive adoption of event-based surveillance and integrated disease surveillance systems. So these types of the monitoring of these systems is voluntarily reported to the WHO as part of compliance with IHR's Annex 1. But the WHO only releases data in aggregate. So we only get a little bit of an impressionistic view. But over time, we can see that there's been sea changes in the amount of adoption of event-based surveillance and integrated disease surveillance systems. So in the African region, 35 out of 47 countries as of 2019 are involved in integrated disease surveillance systems. And in EMRO, which is a region in which I do a fair amount of work, 8 out of 22 countries. And I picked these regions specifically because these are not regions that are specifically known for having a lot of data protection and a lot of human rights, a lot of support for human rights necessarily. So focusing specifically on Africa, on the left is 2014, and then the colors are not intuitive, so I'll just walk you through this. But in general, so red is bad, gold or yellow is getting better, and green is good, in the sense of increasing adoption of elements of event-based surveillance and integrated disease surveillance systems. And what we see is over time, there's increasing adoption of various different elements of event-based surveillance and integrated disease surveillance systems. And I just picked this one region, but you can go to other regions and you can see that this is generally a global trend. But it's also, I think, in my opinion, very akin to social listening. Because what do we do in social listening? We are looking for signals. We're looking for information that may constitute an event. We're trying to triage and verify those events. There might be some sort of public health threat based on this information that we're gathering. We need to do a risk assessment to decide if there's any action that needs to be taken. So this is literally the same diagram that from event-based surveillance. I think in social listening, methodologically speaking, we're essentially doing the same thing. We're also, and this is the work that I do with my research, we're doing community-based surveillance. So what do? I train infodemiologists who are people pulled from the communities in which they work so that they can try to understand what are the questions that are circulating, what are the rumors that are circulating, and how can we develop ways to address some of those questions, concerns, and rumors within the values and the identities that the people in that community have. So we're doing essentially community-based surveillance for infodemics. So what does this look like if we start to think about integrated information surveillance systems? That's exactly what we're talking about when we're talking about infodemic management, right? But we are removing indicator-based surveillance. So indicator-based surveillance, it doesn't really exist yet for when we're talking about infodemics. Maybe that's something that could. You could argue that a term like vaccines cause autism, that's something that probably we should be tracking as if that's a common indicator, because that's the thing that we all agree is not based in fact. And so could be as much of an indicator as trying to understand how much cholera is circulating. But in general, what I'm trying to point out here is we're in a very similar frame where so far social listening has been treated as a technological problem, similar to event-based surveillance. And in a technological problem, we set up the system, and ethics is an afterthought. And then we can iterate and we can try to get better, but we're already in a situation that is akin to event-based surveillance. And I think there's some concerns about that. So what are some of those challenges that event-based surveillance faced? Because maybe we should start thinking about that with regard to social listening. So there's data acquisition and privacy concerns. I'm only just going to mention this to remind us that this is a case, but I feel like this is a domain that a lot of people have talked about, a lot of people who know a lot more about this than I do. I'm going to talk a little bit more about kind of defining an event, as well as thresholds for action amidst uncertainty. I'm going to talk a little bit about defining an acceptable baseline and what kind of the people who work in this field, the really technical people, they call aberration detection. What is it that triggers a public health investigation or intervention? So how do we define event? Turns out there's actually no consensus. In fact, there's only one paper. If you try to find out what defines an event, it's left to every system to decide. It changes, even as a public health emergency evolves. And generally the different systems are trying to figure out how to define event in a way that is balancing kind of, type 1 errors versus type 2 errors, essentially false positives versus false negatives. You're trying to sort out the signal through the noise. So how do you define an event? And this is something that it's shifting. And there's not even, relatively speaking, a lot of discourse and reflection about what this is, what this means, and what are the implications for defining it in different ways. Event-based surveillance also has thresholds for intervention that they call aberration detection. Now, they call it aberration detection because most event-based surveillance is tracking various different indicators over time. So what you see in this cute little infograph is you see a moving averages over time, and you have to define, often algorithmically, what is an aberration that is something that constitutes something you got to look into. And this is done in different ways. Like, are there specific covariates needed, right? Are the phases of the moon actually what's determining kind of your shifts here? And so you need to take into account various different types of things. What type of data is monitored? Are there natural fluctuations in that? Is there a long historical baseline? You need a lot of trends to even start to try to figure out what is an aberration, because you have to know what normal is. that means you have to define what normal is, right? And then you also have to choose what you're going to consider an aberration from that normal. And that is one of the things that they talk about in this is, like in any public health decision-making, that decision is not just based on what is normal and what is abnormal, but what resources do we have to actually try to address this? So, so when we think about event-based surveillance and all that event-based surveillance has done and all the somewhat ethical challenges that event-based surveillance has, even as it's trying to iteratively improve, if we try to think about kind of the global adoption of ethical guidelines for evidence-based surveillance, it's not reported to the WHO because it's not required to report, and it's not even voluntarily reported under Annex 1 of the IHR. So this is a very short slide because we actually don't know the answer to this. I think that would be an interesting empirical question, but I'm not sure someone would have to ask these questions. This is not necessarily something that I think people would be very willing to divulge. Certain props to Andreas here, but there are a plethora actually of different kind of discussions and guidelines on ethical issues in public health surveillance. And notice the phrasing here. What institutional mechanisms should be established to ensure ethical issues are systematically addressed before data collection, use, and dissemination? My emphasis. But that before is not actually what is currently happening when we talk about event-based surveillance. And I would argue not happening as social listening systems are also being set up. But there are a lot of discussions about this, right? So I mentioned GFIN, 1994, okay? And then since then, there's been a lot of discussions about big data and public health, ethics and privacy issues of a practice-based surveillance system, ethical challenges as big data and public health. This came out in 2015. Ethics and governance for digital disease surveillance. This was published in 2020 after a lot of discussion regarding event-based surveillance for COVID. Resurrected a lot of these discussions and debates. And then ethics, integrity, and retributions of digital detection systems for infectious diseases. This was a systematic literature review that actually came out in 2021. So, you know, this is a good 20-something years into the event-based surveillance, integrated disease surveillance methodology. What have we learned? Well, 6 ethical issues came up. Awareness of implementing digital surveillance, digital integrity, trust, privacy and confidentiality, civil rights and governance. Sounds familiar. But the public had concerns about receiving inadequate information, unclear governance frameworks, and a lack of privacy protection, data integrity, and autonomy when utilizing infectious disease to digital surveillance. We're 20-odd years into event-based surveillance, and we do not have ethical guidelines, ethical structures, frameworks, and governance structures in place for something that's been in place for well over 20 years and in use even during pandemics. I think this to me, this raises a lot of concerns when we're starting to talk about social listening. So when we think about some of those ethical challenges that event-based surveillance still faces, there's a consideration of power imbalances, data protection and event signal detection. It relies heavily on existing data protection infrastructure. Professor Cao recently just spoke about kind of the data protection infrastructure in China. There's data protection infrastructure in the United States and in Europe. But a lot of the push and the pressure to implement systems in various other countries, like in the Africa region and the Emira region, is done so without necessarily much thought or concern to whether or not data protection infrastructure is in place. It's a technological problem. There's also little consideration as we're instituting these on what constitutes an event and the implications. Who decides what an event is? I also mention this because this is, so being from the United States, some of the groups that do this, there's a team from the Centers for Disease Control that has put a lot of funding and a lot of energy into working with different countries that are interested in setting up these systems. So this is something that, this is a project, and there's some discussion about how much this might be a little bit of a colonial project in the sense of let's make sure that you have disease systems in place so that you can detect diseases so that they don't come to our country. And I think that's an interesting framework to think about social listening because there's actually the reverse flow of the toxic information. When we talk about governance, it often also relies on existing governance structures in health and public health institutions. But there's little accountability outside of those existing structures. So if those structures don't exist, there's essentially not much in terms of accountability for these event-based surveillance systems in various different countries. And in conditions of uncertainty, public health logics often dominate. It often tends to take a precautionary approach where, unfortunately, the values are often implied and universal, right? Because this, a lot of us have a little bit of public health bent. I think we'd all kind of nod our heads to the values that are there, but I think we need to recognize that there is a spectrum along these values between things, for example, population safety versus individual autonomy, and not everyone would necessarily agree with the values that we have that are being put into a lot of these decisions in terms of defining events and in terms of defining the action thresholds at which we actually start implementing interventions. So why has this happened? I will start off this slide by saying I don't know, because there isn't necessarily a lot of empirical evidence here. But as someone who's been watching this field for 15 years, I would say there's unintended consequences of Annex 1 of the international health regulations, which puts a lot of pressure and incentivizes member states to report, comply, and implement the various different core capacity requirements. There's also a lot of international support for implementing event-based surveillance and integrated disease surveillance systems. And let's worry about the safeguards later. There's also, and I think this is the key, there's actually a lack of practical guidance on how actually to set up these ethical safeguards or governance structures during implementation. No one knows how to do it, and there's no guidance. So as people are setting up these systems, it's a technological problem. They've got technical guidelines on how to set up these systems. But if you don't have a practical ethical guidance on what you should be doing at the same time, what do you do? So I would like to say that as we're talking about social listening, it is akin to event-based surveillance and integrated disease surveillance systems. We don't know who defines what an event is. It's different in different places, and who sets the thresholds for interventions. We don't necessarily have set processes for how those things are defined and refined over time. We don't have a sense of what safeguards are needed prior to initiating a social listening program. That's part of the reason why we're here. And I would say that there is some discussion along these lines. For example, in the 6 steps on creating an infodemic, I apologize with the jet lag. I'm losing a lot of my nouns, but the infodemic insights report does a fantastic job of kind of laying out some of these things and offering at least some ways that you can start to think about this in terms of, if you're going to have thresholds for making decisions and initiating actions, there's low risk, moderate risk, high risk, but who decides what is low, moderate, or high risk, and low, high, or moderate risk to what? How are those decisions reviewed, right? Are there accountability mechanisms, right? These are things that are only kind of scratching the surface in our current guidance documents. What should be monitored with social listening? What's the unit of analysis, right? When I talk to researchers, a lot of researchers focus on misinformation at the level of a claim. Is this statement false or misleading information? Should we be talking about rumors and conspiracy theories? We, in infodemic management, talk a lot about narratives. I come from public health. I actually think a lot about corrupt information environments. What is the information environment that we're all immersed in? And I would argue that our information environments are social determinants of health. So the concerning trends that I see already in social listening is that there's a lack of indicator-based equivalence, which means that infodemic managers are more reliant on event-based data and all of its foibles for any insights. Very high signal-to-noise ratio. A lot of needing to balance with all of the values implied, kind of, are we leaning towards false positives or are we more okay with false negatives? So, and these are decisions that are already being made. There's also the drive for ever more data streams and seamless integration for infodemic management, more community engagement, which I think we all agree is a fantastic thing, but that also just brings in more ethical challenges and much more need for guidelines and structures and governance. Social listening implementation, I would also say, like event-based surveillance, far outpaces the implementation of any ethical safeguards or governance. And because I would say right now, there is a certain pressure to implement the system, even when data protection infrastructure is not in place. Less than the international health regulations, but as the international health regulations and the core capacities are being redefined, what's going to happen? Is social listening going to get mentioned as something that is a very important thing that needs to be part and parcel of infodemic management. It's already being mentioned by European CDC as a core capacity for people that are trained in their EPIET intelligence network. So in summary, ethical guidelines aren't enough, in my opinion. We've got 20, 25 years of experience with event-based surveillance to show that unless we implement ethical guidelines and safeguards at the same time that we're implementing the actual technical process, it ain't gonna happen. Practical guidance is essential, I think, as are accountability mechanisms. And the trend towards event-based surveillance and integrated disease surveillance systems foreshadows what I think we're gonna see over the next 20 years of social listening, unless we're able to kind of really try to provide some practical guidelines and make sure that the incentivization is in place so that ethics gets implemented at the same time as the technical solution. There's, as I mentioned, just keeping in the back of our mind, the data acquisition, privacy concerns, definitions, and power imbalances that are related to those definitions, as well as the thresholds for action amidst uncertainty. References, happy to share my slides for anyone that would like them. And with that, I just leave you with the phrase, an ounce of prevention is worth a pound of cure. And with that, I look forward to taking your presentation after your questions after Joe's talk.
Thank you so much, Professor Scales. Join me in thanking Professor Scales for his excellent presentation. It links up very nicely with a number of issues that Professor Cao has highlighted. Well, just a heads up, Professor Scales. Thank you. We'll be very interested in your thoughts, especially in response to what Professor Cao has mentioned about terminology, because your emphasis seems to be very much on surveillance, whereas Professor Cao has invited us to think more broadly about the term. So perhaps it's something that we can take up in Q&A. Our next presenter, I think, complements what Professor Scale has mentioned, because Professor Scale has very nicely highlighted the technical aspects that's linked particularly on surveillance to infodemics and infodemic management. He's highlighted, and thank you so much, Professor Scale, the relevance of the ongoing work, the WHO in developing this ethics guidance document. So we're now very privileged to be joined by Professor Joe Ali. As you see, he has a long history working in the space of both law and bioethics, bringing the two fields together. He's highlighted a number of important normative issues that have actually, and will continue to arise in the implementation of a range of digital technologies in healthcare, including public health. Professor Ali, of course, comes from the Berman Institute at Johns Hopkins, which has reputation, having worked in this space and have made wonderful contributions to the bioethics literature. So with this, welcome, Professor Ali, the floor is yours.
Thanks very much. Okay, thank you. Hi, everybody. So I'm going to share some thoughts on this subject, acknowledging, that my thoughts aren't completely formed in many senses, and I think that's reflected in the fact that, as you see in my presentation, I have a lot of questions. I've actually noticed that many of us presented our work in form of questions, which I think is indicative of something. I'm not sure what, and maybe it's just our evolving understanding ourselves of this emerging area. So so I'm going to focus. It actually follows nicely in some respects on several of the talks we heard today, and actually Calvin's initial introduction at the very start of this conference in speaking about values. We've heard that word frequently, I think, throughout various presentations, but I'm hoping to dig in a little bit more deeply into that concept of values in relation to this subject, and to focus also on the idea of digital culture and how digital culture affects what we hear and what we listen to. So I will, again, just emphasize that my talk, again, is like many, I think, is focusing mainly on the digital context, on digital social media and information that we derive from social platforms online to support social listening. And I am inviting consideration of the place of values in digital cultures and information and communication spaces. And it's interesting, that's a phrase that we started with in this technology space. Many of you may remember when we used to call ICT, right? Information communication technology. We seem to be coming back to that concept again now in our discussions around the use of technology, especially with AI and chatbots and the like. So I'm drawing a bit from some work we did in early 2020, a group of us at Hopkins, including on digital contact tracing, thinking about ethics and governance. We developed a book and some guidance on this from a US perspective mainly. And as well as a paper we wrote in early 2020 in the Lancet on building trust while influencing COVID-19 content in the social media world. And in that paper, we were focusing intensely on this idea of this tension between intervening in some way or another to address misinformation and disinformation in social context, while also maintaining a safe space for deliberation and discussion and disagreement about policies and about other aspects of social life, while trying to really fundamentally preserve and build this idea of this concept of trust in public health. So I just want to start with what I was thinking about this topic in terms of, from an ethics perspective, what I thought of as some of the key ethics goals or expectations, I guess you could say, in relation to social listening. And of course, it starts with this idea of gaining insight into public understanding and needs and concerns. So I'm framing that really, I mean, it's the core function of social listening really as a public health matter, but it's also an ethics matter, right? We ought to be able to produce something of benefit from this activity in order to ethically justify it. So that is certainly the first and key target, I think, of social listening. But we also ought to be mindful, of course, of avoiding causing individual and collective harm, responsibly utilizing public health power and resources, right? Resources are not unlimited, and preserving and building trust again in public health. So I think this again draws from the work we did on digital contact tracing, but I think it actually crosses over very nicely in that we have this challenge in this space of social listening, and I'm calling it an alignment challenge. But it acknowledges that there are many different factors that have to be well coordinated in order to realize this potential benefit of social listening. It includes a clear, articulable understanding of the science in order to be able to detect, again, what is accurate information, what is misinformation. We also have to have an understanding of how the public perceives these kind of uses of technology and what's acceptable and not acceptable from a public opinion kind of perspective. We ought to think about our capacity to implement these capabilities in public health effectively. What can we say confidently about our knowledge of the method and the performance of that method? There are, of course, a range of legal issues, again, public health needs that need to be identified and articulated clearly and aligned. And then, of course, the ethical values and principles, which many of us have been focusing on in our discussions here. Over the years, though, and this was evident in previous presentation as well, there have been so many expressions of normativity in public health and in global digital public health. So I've just thrown a bunch of them up here on the slide almost randomly, but it includes, again, various statements around the use of digital technologies for support, proximity detection and contact tracing, exposure notification. Those have been put forward by academics and scholars. They've been put forward by NGOs. They've been put forward even by technology companies like Apple and Google, who have put out their terms of use and agreement that specify who can use these technologies and who can't. And a whole range of other comments and statements about principle and value emerging from the literature and from other sources. So you could ask, and I think rightly so, do we need more principles? Do we need more statements of values? Or what do we need something else in this space? So again, there are just many normative statements and many normative influencers, and not everybody's opinions and guidelines and perspectives, of course, align. So everybody on this slide, plus more, have been in this business of claiming normative ground in relation to the use of digital technology in public health for different reasons too, not all for the same sort of reason. So when I was thinking about this space a little bit more in terms of an empirical territory, right? Because we don't have a lot of empirical information at our hands yet about ethics and governance, and frankly, about the use of social listening as a public health tool. Two questions came to mind for me, and I know these are fairly specific, but the first question I'm not going to address, it relates back to all of those normative guidelines that we already have in place. And the question I've asked here is how do personal values in digital cultures affect our ability to realize global normative expectations in digital health? So what is the relationship between individual values and the sort of digital context in which we operate today and the cultures that have formed in those contexts? How do those elements affect, again, our ability to realize and implement these normative standards? Because ultimately it comes down to individuals and their behaviors and communities and their expectations. And the second question, again, is more specific to this context of social listening, is how do personal values in digital cultures influence the nature of digital communication? And therefore, what we hear through social listening. So I'm going to focus again on that second question a little bit. And I'm drawing my inspiration here from other people's work, like we all do. And that includes some work that was done by a number of colleagues, including Helen Nissenbaum, a little while back, over a decade ago in 2008, that raised this question in the context of this paper that looked at embodying values in technology. And as you can see on the slide, what they wrote is if in an ideal world is one in which technologies promote not only instrumental values such as functional efficiency, safety, reliability, and ease of use, but also substantive social, moral, and political values in which societies and their people subscribe, then those who design systems have a responsibility to take these latter values as well as the former, as well as the former into consideration as they work. So I think that's a task that it seems like we've trying to take on here as well. Is saying we understand the functional objectives of social listening to some extent, but we also have to take seriously these other social and normative dimensions. And then I'm also drawing from a more recent paper by Jay Shaw and other colleagues in Toronto they framed it, including, I think, building a lot on this work, as well as the work down at the bottom of this slide on computing ethics and thinking about values and design as a concept, as a sort of socio-technical enterprise. So that what they've said is we suggest that an ethical perspective confined to functions of the technology is insufficient to assess the broader impact of the adoption of technologies on the care environment and the broader health-related ecosystem in which it's a part. So this idea of embedding values in design, I think, is a very important one to consider when we think about technology and public health. And it's commonly the case, if you look at all the regulations, you look at many of these guidelines, you look at that there's a strong emphasis on the value of privacy and some emphasis on autonomy, and not a whole lot of else. So when we think about values and thinking about technology and technology design, we ought to ask, I think, a number of questions, including sort of what other things do we value in society and as communities? And how can we design and utilize technologies in a way that recognize the plurality of values that exist? So let me just run through in short order a number of these kind of what I'm calling exploratory sub-questions that I'm asking, at least of myself, when thinking about this topic. So first is, what are we listening to? The second is this question of what is digital culture? The third, what influences digital culture? What kinds of things do people value? What influences personal values and beliefs? And how is digital social status represented? Whose values are prioritized, and how does technology design influence digital communication? So each of these could be a dissertation. Like these are immense questions, and I'm not going to stand here and sit here and say that I'm going to answer them, but I'm just going to offer some thoughts with the hope that it might stimulate some additional thinking on this topic for a discussion. So let me begin with this first question of what are we listening to? So when we go online and we look at social communications in an internet, oftentimes context, what we're seeing is knowledge production, sharing of that information, and a process of legitimization, right? So there are various mechanisms in social media context that help to legitimize and delegitimize the information that's presented. But we also see entertainment, right? And we see all sorts of emotives, expressions of emotion. We see curiosity, we see confidence, we see uncertainty, we see comfort, discomfort, fear, anxiety, skepticism, boredom, humor. And these are all mixed oftentimes. They aren't sort of clear reflections of emotion. And of course, uncertainty is part of that, but it's not the entire landscape. We also observe, and when we listen, is this idea that there are communication norms and relationships and hierarchies within digital media contexts. And often those are unique to different digital fora and the characteristics of those fora. So there's been a lot of sociological literature and other forms of literature that's tried to characterize what it is when we call this concept of digital culture. And I'm offering one sort of framing on this, which I think was helpful to me in relation to social listening. And that is to think about digital culture as something that's emerging, and it's an emerging set of values, of practices, of expectations regarding the way people should act and interact within the contemporary network society. And that's offered by Deuze in 2006 in this paper, Participation, Remediation, and Bricolage, considering principal components of digital culture. So the way he describes it is having these three different components. So one characteristic of a digital culture is that people are active in that environment. They're active in expressing their agency and in this process of meaning making. They also, as he says, engage in a process of remediation. So they adopt, but they also modify and manipulate and reform consensual ways of understanding reality. And then lastly, bricolage, which is kind of this creative endeavor of this reflexive assembly of personal versions of such realities. And so this might sound very familiar in the context of mis and disinformation, where people are constantly making meaning of the world and of their uncertainty and of the statements they're hearing outside it in various contexts. And they're participating actively in this process. So digital culture is a concept, again, that's been defined in various ways, and it's certainly present in the world we live in today. And there are a lot of influences on digital culture, including our personal values and beliefs as tech users, the design capabilities and limitations of technologies themselves, the strategic priorities of technology developers, the norms that are established by communities of users and content managers, as well as moderators, and then all sorts of external systems of governance, including legal constraints on what can and can't be done in those fora and with the data that are derived therefrom. So let me focus then briefly in my next question that I'm asking on this notion of personal values and beliefs. So again, what kinds of things do we value? Well, if you read the literature, you'd think everybody values privacy and security, which some of us do, but there are also a range of other things that we value, including our health, companionship, economic well-being, kindness, efficiency, equity and fairness, autonomy, patriotism, solidarity, etc. And it's very, very common to find all these expressions of values in digital social networks. It's also, I think, fairly uncontroverted that people's value priorities shift, and oftentimes when circumstances change. So those circumstances are so again, moving from thinking about what influences are, or what constitutes value in everyday life to what influences these values. Again, there are multiple factors. This is such a layered and complex space, and that's what makes it, I think, so interesting and challenging for us to engage with. So people's values are influenced by individual factors, their social status, their previous experiences, their previous risk exposures, community factors, shared traditions, belief, values, political factors, visions for the past, visions of the past, visions of the future in terms of social order, and then a range of what I'll call environmental factors, which includes things like public health emergencies. So many of us were stuck at home for a year and a half, whatever it might be, may have reordered our priorities and our values a little bit in that world that we were living in. And that's a very sort of natural phenomenon, and it happened, and it will continue to happen as we progress. So the idea, though, is that when we are in a social digital context, there are some people whose values, whose voices are articulated and who are heard and who are thought of as being legitimate more so than others, and it's well documented. And so you can ask this question then of how is digital social status represented? Well, in a social media context, again, I'm saying things that many of you I'm sure are very familiar with. It has a lot to do with the extent of one's social network, the perceived influence of others in one's social network, the unique capacities and responsibilities that are granted by the social network or peers or others. So you may have some kind of content moderation capacity or other things like that. And then, of course, all sorts of different kinds, and this is constantly evolving, of community or network generated indicators of value of the contributions that you're making. So it could be likes, it could be, dislikes, whatever it might be. And then interesting, I think, drawing again from sociological literature here, it also includes the capacity to convert social capital into other types of capital, such as economic and cultural capital. So yesterday there was a discussion about why don't we control this through an economic channel and thinking about these issues. And that's, I think, connects directly into this line of thinking about how we define social status in a digital context, thinking about what are the levers. If you think of social status as being a driver of influence, what are the levers that might help to achieve sort of desirable public health ends in those contexts? So values are prioritized again, and in different people's values are prioritized. There isn't sort of equal weight, of course, given to everybody's opinion and comment in the digital context. Social listening tends to prioritize, of course, public health interests and values, but of course, as we know, public health interests aren't understood, as we just heard, or even prioritized by everyone. It's also very challenging and argue not possible really to restrict infodemiological analyses to public health uses. So one of the biggest challenges that people who think about ethics and governance in digital health have in thinking about public health use of data is sort of how does one restrain the use of complex outputs valuable outputs from complex analyses in public health to legitimate public health uses, right? Because that data can be used for so many things. If I'm doing global surveys on NCD risk factors, and I'm looking at tobacco consumption, of course, the tobacco industry is super interested in that information as well, right? So to constrain and contain that kind of analysis and information is extremely difficult. And it's the same is true when we look at communications that people have. And it's no surprise that this methodology is closely linked to methodologies that are used in corporate marketing environments and those sorts of things to know your consumer in order to direct the sale of goods and other products to those individuals. So this triggers a lot of debates amongst ethicists, debates among public health professionals and others about the acceptable use of technology and design trade-offs. So you can design things to be more secure or less capable of achieving certain kinds of ends, which may be negative on the ledger from a public health perspective, but may be positive in terms of preserving this idea of legitimate public health use. So you can see all sorts of discussions that have been had over the last several years and decades, indeed, around this, including looking at, for example, discussions surrounding the public health value of these maximally privacy-preserving technologies for participatory disease surveillance versus more centralized, perhaps, approaches where there's some level of identifiability or location-based data that can be quite valuable to public health authorities, but again, maybe compromises some values that certain people think are very important. So, and again, it could have maybe a similar debate across various dimensions in social listening, including maybe around the relative value of more active versus more passive forms of social listening. I think we heard a presentation yesterday and a colleague was saying, maybe we should be thinking more about using active social listening instead of passive because it's more engaged and it may be more acceptable. But it comes at a trade-off, right? You may not be able to learn as deep and as broad of information, or at least as broad if you take those kinds of approaches. So this is again, from the perspective of the subject and the way I'm framing this topic today, I think questions about value priorities and the tensions that exist in framing our values as a society and then as sort of sectors within society. So the last question I raised for our thinking is, how does technology design itself influence digital communication? So of course, technology design can shape or constrain the messages and how the value that I've been discussing is perceived. And that can be done through the type, again, we've been talking about listening versus watching, right? These different kinds of opportunities or neglected opportunities for engaging with different kinds of content modalities in this context. Length limitations on the type of text that's inserted in the social media platform can of course shape the type of communication that's made. Rankings, authentication efforts, verifications of people who are in a Twitter or X environment who are authenticated or verified, who are then seen as perhaps more legitimate in terms of their communications and like alerts and all sorts of different things that can or can't be programmed into technology that affects the nature of the communication, the meaning, the semantics, and the legitimacy of that communication. So we have to understand the choice architecture. We have to understand the technology. We have to understand the digital communication systems to make meaning of the words. And that's sort of the key take-home message, I think, for me from this talk, is that we need to take this kind of broader perspective on social listening, that again, borrowing from literature, thinking of it as a socio-technical lens on digital social listening that puts the communication there at the center. But around that are these concepts of digital culture, digital social status, values and beliefs, and then technology design. And I know this is probably an incomplete picture, but it I think guides us a little bit in thinking about the relationship between these different elements that help us to understand the communication itself. So just some brief summary points and a couple of further considerations. So again, the meaning and influence of digital communications can't be derived from an understanding of the technology alone or the words alone. So I would argue we need to take on this socio-technical approach. Digital cultures, values and beliefs, digital social status, and technology design influence what is communicated, what is legitimized and understood in digital spaces, and are themselves shaped by numerous factors. I've started to outline some of those. And then just a couple of side or cautionary notes, perhaps, in thinking about this, that of course, expressions of values are found both online and offline. And in one individual may be divergent, they may converge, they may diverge. So I think we ought to not assume that someone's beliefs that are represented in their communication in an online environment are the same as the beliefs that they might communicate and represent in other contexts. There are various influences, again, that are contextual, that shape those communications. I might say something different to someone face-to-face than I would on the internet. And then the very act of what we could think of as official listening has the potential to change the nature and the content of communication. So again, this is a constantly morphing space where we might hear something, and the fact that again that we're listening to those communications might make that thing we're listening to change from day one to day two. And even those very technologies and platforms may shift in response to the act of listening. So I'll leave it there and just thank you all for your attention.
Okay, thank you very much, Professor Ali. Will you join me in thanking him? We're going to press on in the interest of time because this is the final panel for at least this segment before we move on to the evening public session. And may I invite all three of our Brazilian presenters to the front. So if that's okay, my esteemed colleague, Professor Leung, will introduce the three of you.
Right. Thank you, Calvin.
Over to Professor Leung. Thank you.
I don't know why you decided to ask me to introduce these three speakers. You mistook me as a Brazilian because my first name. I'm Gilberto, but I was actually Gilbert. Someone asked me yesterday. I'm not Portuguese. My father was born in Macau, hence I've got a Portuguese name. Otherwise, I'm Chinese. Anyway, it's my pleasure to be introducing our three esteemed speakers today. The first talk is going to be on vaccination in Brazil, the politics and infodemic, appropriately delivered by Dr. Isabella Villani. She is a pediatrician. She does a lot of work in vaccination and education and communication. And she is a member of the Brazilian Society of Infectious Diseases. which apparently had been monitoring the Brazilian president's private channel on social media and also the Ministry of Health, all very MI6 and CIA sounding to me. So I look forward to your talk.
So thank you, Calvin, for the kind invitation, the excellent event, and congratulations. So I'm gonna tell you about a story from Brazil, the little bit of what you have done in your country. I don't have any conflict of interest here, and I will read it. And so what I will be here, I will try to show you how the Brazilian Immunization Society monitored the misinformation in Brazil, or strategies to deal with the facts, the impact of adherence to COVID vaccine in Brazil, and consequently on the control of COVID-19 in our country. In Brazil, vaccine acceptance growing since 2015. This information was already present, but it was not the main factor that led the population not to get vaccinated. The infodemic changed the circulating narrative and impacted people's perceptions, attitudes, behaviors, and it allowed anti-vaxxer group to be structured in the country, which was not the case before. The denialist stance on COVID-19, minimizing its severity and supporting ineffective treatments, in addition to government's discourse against COVID-19 vaccine, contributes to a scenario where the risk factor for vaccine acceptance prevailed. So, public trust, preference for alternative health, political polarization was the major problem, and we have based extremists. The president and his minister of health have taken it upon themselves that each new information or new policy would generate doubts by questioning vaccine recommendation and not infrequently the minister himself announcing reports of possible health problems following vaccination, even if the causal relationship was discarded by the Ministry of Health. The Minister of Health, the pharmacovigilance of Minister of Health. For example, he went to the traditional media to say that 4,000 people had died after taking the vaccine. It was the number of notification. The majority with the causal relationship to the vaccine discarded by the Ministry of Health. So, socialism. You know what's socialism. And it's important to repeat that data used for infodemic insight, socialism, and infodemic management encompass both online, offline, and also involving community engagement. And we have to listen to all of them. And when integrated with other data sources, such as user search trends, epidemiological data, health system, and social behavior data, it yields infodemic insight to identify, categorize, understand the concern and narrative expresses. So socialism and infodemic insight use an integrated method for public health analysis and insight generation to inform evidence-driven infodemic intervention. But what happens when public authorities are the main driver of misinformation? So, the governments, of course, cannot be expected to play this role when he is the biggest misinformation creator. Thus, Brazilian Immunization Society has been responding implementation intervention seeking to mitigate the infodemic and its harmful effect. However, we do not have the search for a structural socialism. Finding the disease means waging an information war alongside the medical battle. It was we have done in Brazil. We dedicate ourselves almost entirely to following the official, what you listen, the official discussion of the Minister of Health. We was part of the advisory group for COVID-19 for the Minister of Health. So we discuss the technical definition, but the ministry and his president change what the recommendation and everything. So we listen the official discussion on the official discussion of the ministry, messaging in groups and doctor social media because the doubts was there. Journalists demand, president social media, very important, and official speech of the Minister of Health and the official epidemiological data available concern the disease in the country, and through social and traditional media, we seek to disseminate the correct information. We also create a committee responsible for feeding almost daily the COVID-19 channel that we create on our two websites. We was the reference for doctors, population, and public professional of public health of the ministry. So in this channel, we have epidemiological reports of supposition of the ministry and as well, because the ministry didn't publish their position. So we publish their position paper, or technical notes and document response to speech considered not true from the minister and the president himself. Listen to the president. We could know where anti-vaxxer and denialist groups would be or what they would say. Should socialism be applied in response to ongoing health threats? Yes, the answer, yes, I think. In the context of infodemic management, the most common use of socialism is in the generation of insight reports, where data is unearthed regarding communities' values, beliefs, and questioned can serve as strong evidence to support a recommendation to intervene, ignore, or stay vigilant regarding specific points of health, dis and misinformation, overload, information voids, question and concern raised by different community. And so we can do this more easy. Yeah, showed socialism. No, this, sorry. And how can social listening be used to identify mis or disinformation on serious health threats? And how can it guide appropriate response and by whom? Without structured monitoring, the hardest thing for us was to do pre-bunking. Because preparing people to receive possible information, and we don't do really monitor, it's difficult. But about debunking, we demystify by informing the correct facts, showing concrete data that disprove unfoots. Technical data, but in a way, a simple discourse, simple words for the population. Fact checking, I can say, we working on during the COVID for the traditional media. It was 10 interviews by day or more. And for these, so many traditional media have a channel to fake and truth. And we was the reference for them. So I will present to you some situations that make it possible to demonstrate some factor of creating impact on of adherence to vaccination against COVID-19. So this is what our president here okay. Well, I can say when the availability of COVID-19 vaccines was announced, the president announced on Europe, on the US, Australia, not for us. The president, who had not yet placed any order for vaccine, started to say that no one would be forced or pursued to get vaccinated. Why? He was expecting to seek to generate distrust in the vaccine, and mainly the only vaccine we have a chance to have, the Pfizer one. He promised Brazilian people that he would not buy the Pfizer vaccine if the industry did not take in writing responsibility for the vaccine adverse events. During this period, Ministry of Health also created a document in which the population should sign taking responsibility for choosing to be vaccinated. The Secretary of Science and Technology Innovation Strategic Inputs, a Brazilian engineer and politician, on December 22, cited a note that COVID-19 had no proven effectiveness near safety, while the treatment with hydroxychloroquine, yes. You can see here. Yes. See, it's yes. No, it's no. And it's the Secretary of Science and Technology. But Brazilian people love vaccine. So if the number of cases, the number of cases, it was impossible to, nothing was able to prevent Brazilians from getting vaccinated, except the lack of vaccine. Pursued by the discontent of the population, the president increased his diana list, discourse, defending and formally distribute kits of ineffective medicine, official distribution of ineffective vaccine. About the adolescent vaccination, because the politicization, yeah. Our states normally become to vaccinate before the ministry. And it's what happened with the adolescent vaccination. So we had more than 80% of adolescents vaccinated in the country when on 15 September 2021, the data that set by the Ministry of Health to start the adolescent vaccination, according to him, he said, as a president's request for him, he announced a death caused by the vaccine on the traditional media. However, the causal relationship had already been ruled out. And so, because these deaths, he recommended the suspension of the vaccination of adolescents. I was crazy. On the same date, it's been sent a note which is its technical position to the main channel of Brazilian traditional media. It's one. On this document, we destroyed each statement present on the ministry's technical note because it was a technical false note about why stopped adolescent vaccination. On the evening, the document was in the main Brazilian traditional media on the TV and created demand from many journalists for whom we were available to speak the truth about the case. It's important to say that Brazilian people look more for the traditional media that the social media. And on September, our ministry, he said, and of course, during the meeting of the advisory group, we said if he didn't destroy this information, we're gonna say bye-bye. Once a month. So, in this time, like I have said, on 20 September, 5 days after, the minister tried to explain himself on the traditional media, not denying the relationship of the death and the vaccine, but saying that events does not invalidate vaccination of adolescents. So there exists. But fortunately, on this occasion, 80% of our adolescents was vaccinated. And when finally the anti-vaxxer succeeded, medical societies and the population criticized the government's delay in deciding on the vaccination for children 5 to 11 years of age. On December 23, 2021, the Minister of Health decided to hold an online public consultation to find out whether or not the population would be in favor of vaccinating children. This is Prism. Okay? Never in Brazil. But after the population expressed approval for children vaccination, anti-vaxxers are greeted by the president for an official closed door meeting. And for the first time in Brazil, a public audience about vaccination is held. And he was invited. On January 4, holidays, 22, the Ministry of Health promotes a public hearing on the vaccination of children and invite representatives of technical advisory committee for immunization in COVID, including me, to present their technical arguments. But they did not inform that also 4 doctors against vaccination would be there presenting their arguments too. And it was it's the home of Barro. But Barro have not with this. Nobody knows about this. It was only a technical audience. So they was invited by the Minister of Health. She Hopkins, na casa dele, she in the house of Paulo, and he present at the meeting an anti-vax deputy publish our personal data on social media through the anti-vax structure. And immediately we were attacked in every way, including with the publication with the post drive by robots on social media. So pressure by the ministry, because we asked the ministry, because the document was sent to the ministry and not for the deputy. So, the pressure by the minister, this Biakisis, a deputy, she confessed to be responsible for that, but nothing happened, and we members of other scientific society continue to be publicly exposed. And now we have things like that. It's a girl. She was taking the vaccine, very happy, and they take her video, and what they say is rest in peace. But the girl do not die. And photos about children like this were something. And I don't have evidence, scientific evidence to say what I will say, but when we look up our vaccine coverage, COVID vaccine coverage, you have 19.4% we have 24% for those with 40 years or more, 85% for those 18 to 39, 80% to those 12 to 17, and 54 to those 5, 11, 70% for those 3 and 4, and 6, 7% for the second dose, and 1%, never saying that, for those 6 months to 2 years of age. And here, between the end of 2022 until now, children, especially those under 1 year old, but until 5 years old, were the only age group with increase in case here. Oops. Here and left. They were not here. The only people not vaccinated in Brazil. But I don't have evidence for this. What ethical, legal concern those socializing in response to a serious health threat give rise to? First, must reconciling with the interest of public health, and it's necessary. To protect rights for privacy, data, and fundamental rights and freedoms. So it's important to understand that the most of the information isn't even false, can be genuine, can be opinion, and how that how you think we have done. In our case, the privacy was not respected by us because there are facts public and presented by public authorities on the traditional media and through documents released and signed by the minister. The context was one of public health authority contradict data published by themselves, WHO recommendations, and scientific publication. Fundamentally, rights and freedoms were not taken from these people, but the right to scientific and true information are guaranteed for the population. And this can save life of many peoples. And how to guide the authorities or not the health authorities, you have to think about this. That's our current challenge, to guide the country to this. It's now the challenge of WHO. Guideline in the hands of health authority responsible for managing the infodemic may allow for bad outcome and low risk of non-intentional errors. Oversight would allow the guidelines to be followed. Social listening in the hands of people or institutions with financial, political, and other goals that lead them to destroy people's trust in science, public authority, and health profession. This can kill. Killing during the COVID-19 pandemic in so many countries. And how to supervise it, those in power are the great destroyer of people's trust. Who should take this place in this condition when we don't have trust in the authorities? So I will find finally it's the same in the majority of countries of Latin America. And I think that for the next infodemic, we can be prepared to obtain epidemiological data about infodemic, identify the symptoms of the infodemic, identify the carriers, and even establish a simple treatment. Thank you.
Thank you so much, Dr. Bella, for this very insightful report of the president's area. In the interest of time, we will have to move on. Next speaker is Dr. Marciangelo Sabino De Vita. She is a professor in São Paulo. She had a PhD in public health, a JD, and also she studied bioethics at Georgetown University, USA. She's going to touch on the morality, the moral dimensions of social listening, addressing the tension between our duty to safeguard health and also the duty to safeguard freedom of thought and expression.
Good afternoon. Ciao, hao, hey ho. Thank you for the invitation to participate in this great conference. Wow. There is an alleged ethical legal conflict in the governance of social listening in the context of serious health threats. In one hand, the Brazilian Constitution not only establishes the right to health, but it determines that health is a duty of the state, so it's very strong. On the other hand, it protects citizens from the great power of the state, safeguarding their privacy and freedom of thought and of expression. Of course, we are fervently in favor of public health, but to what extent? Exceeding your defense could not exactly lead to an affront to health as the WHO conceptualizes it, that is, as a physical, psycho-emotional, and social well-being. Not really. And maybe that's not even the main question to ask, but let's go by parts. It's not a conflict properly because listening society with respect is a duty of the one who communicates so that the message is effectively understood by its recipient. Those who work with public policies have a duty of information, of communication, even because public affairs relate to everyone. And those who have a duty of communication have an obligation of the recipient's understanding of the information, whether doctors about their patients or the public manager about the population. Hence, in addition to qualitative research among the population, it is essential to listen to what happens on social media, even if they don't represent the totality of the society. Social media, besides being a direct source of communication for people, have enormous potential for information dissemination. And in the case of Brazil, its importance is even greater because it is through social media that most of the population access the internet. I explained that. Most Brazilians do not have a computer with internet at home, but we have more cell phones than people in Brazil. However, most Brazilians also do not have a complete internet plan on their cell phones. They use low-cost prepaid accounts for which telephone operators to please customers guarantee unlimited access to the following social media: WhatsApp, Facebook, X, that's Twitter, and Instagram. So collected here some propaganda of this cell phone operators just for you to see. So you see the price here, and it says it's prepaid, so it's very cheap, and it says you have these apps to use in a limited way. So Instagram, WhatsApp, Facebook, Twitter, X, and this one is another one. It's for driving your car. And also in another company, you see the same apps here. So these are free access to everyone, even for people that don't have internet in their homes. They have that for free in the cell phones. Understand that? So it's very important that in Brazil, most of the population access internet in Brazil only through social media, only through these apps here. Well, thus, this majority of the population does not have access to internet websites, such as the Ministry of Health website, but has unlimited access to social media. So, this majority of Brazilians, even if they wanted to, would not be able to check on the official website of the Ministry of Health whether information received via WhatsApp is true. It is also clear that the power and importance of social media in the lives of Brazilians who, not by chance, are among the top users in the world of the social media networks like Instagram, Facebook, and WhatsApp. Thus, in Brazil, social listening via social media is indeed important. So it's kind of different from the rest of the world because of that particularity we have in Brazil. However, taking a step a step back to deal with the message itself and the values it expresses. In the case of controlling epidemics, such as COVID-19, perhaps the biggest problem is that in Brazil, despite the great social tone of our constitution, our culture leans toward individualism. And I'm not talking about giving new superpowers to the state, but of the need for social morality to accompany what our constitution already provides. I'm going to talk a bit more about common morality in a few minutes. Yes, like Isabella said, there was a lot of fake news during the COVID pandemic and spread even by public agents. Politicians without scruples, humanity, and responsibility, who put the lives of vulnerable people at risk, and who also promoted the bad confusion between party politics and health policy. All that to take personal and political benefits. But there was also misunderstanding even among those who shared accurate information and among those who followed the health guidelines during the pandemic in Brazil. And that's the point I want to emphasize here. Unlike the Orientals, who have been wearing masks for a long time when they had flu-like symptoms to avoid spreading disease to others, in my country and in several others in the West, the use of masks by the population was a novelty of the COVID-19 pandemic. And people mainly understood it as a form of individual protection, not much as a measure to avoid the spread of the virus in the community. This is how the saboteur speech has spread as easily as the virus itself, stating that only people who are afraid of using masks, only people who are afraid uses masks. Those who have courage face the open-hearted life. Likewise, so politicians in Brazil did say that, okay? Likewise, vaccines were also seen much more from an individual point of view than from the collective immunization goal. Again, that made those who felt themselves in good health not to feel compelled to vaccinate, as it seems to be only a choice with only individual consequences. Similarly, many people understood that only whoever is afraid of the disease stays at home. It was also said by many politicians. So if you're afraid, stay at home. That's how even among those who followed the quarantine measures, many interpreted them as strictly as a form of self-protection. However, we know that masks, vaccines, and quarantine measures are collective health strategies. So I got here some propaganda for made by the government, local government, state government, federal government, to show you how that question was presented to the population. So, for example, here is one that say, use a mask to protect yourself from the COVID-19, to protect yourself. Again, another one. Oh, do you know that the mask helps you to prevent from COVID and flu? To prevent you from getting COVID and flu. So no, it's not saying about the collectivity, Then protect yourself, use masks. Again, protect yourself from COVID. You should use a mask. Another one. Do you know the mask should be really tight in your face? So if it's not like that, it's not going to protect you from COVID-19. So always the discourse of protect yourself, only yourself. And the same as vaccination here. So this propaganda here says, why are you're choosing, because we have that problem in Brazil in the beginning of the vaccination. Why are you choosing the brand of the vaccine? The virus can choose you. So get a shot now, but choose you again. Now it's São Paulo government, like the most important state of Brazil from the economic point of view, and has the majority of the population of Brazil. So it's a governmental propaganda saying, protect yourself again. The immunization against the coronavirus only happens with 2 doses of the vaccines, but again, yourself. Then for hepatitis, vaccines, protect yourself. Measles, protect yourself, get your shot. Meningitis, protect yourself from meningitis, get a shot. So again, all the time, the same kind of discourse in our public propaganda. In other words, even when a good part of our well-intentioned communication seemed to fail, as it ended up emphasizing the individualistic discourse, which is the same that facilitated the fake news and the lack of empathy for the others. But in such an individualistic culture, would it have had a different effect in communication if we focused on common good? I don't know. Or do we need first a change in our common morality? So now I'm going to talk about that. According to the bioethicists Tung and James Childers' classical book of bioethics, the common morality is the set of basic common values among the various people in a society. The idea is that the content of the common morality changes over time and space, along with the values that a society expresses. Bringing the theory of these classic authors to the present time, Julian Savulescu, another bioethicist from Oxford University. Julian Savulescu, also a bioethicist, states that our common morality is not prepared for the challenges of contemporaneity, and much less for those challenges to come, such as the worsening of climate change, the greater recurrence of pandemics, and the persistence of social chasms, even in large economies. The urgent call for our common morality to evolve is not new. The bioethicist Potter, in his famous book of 1971, defended that what he called a cultural evolution as necessary for human survival. In fact, for Potter, bioethics is the very ethics of survival in the face of problems that threatens human life, such as social inequality and the destruction of the environment. Faced with such challenges, we should unite on our knowledge in favor of the best of people to guarantee the very future of humanity. Potter aligned that wisdom is the knowledge on how to use knowledge for the common good. And we do need that wisdom more than ever. To this conference's discussion, how to improve social listening to better communicate with the population and pass on the correct messages without extrapolating the duty to listen, transforming it into an abusive social surveillance. But even more, how Western societies can understand that the individual and the collective do not cancel each other. How finally to develop our common morality for present and future challenges if our system is so rooted in individualism. We have some paths when reflecting on each of these points, and I believe you all have some ideas too. I'll be happy to listen to you. First, there are already services even provided by on-demand companies that monitor social networks and other online data sources using licit and aggregated and publicly accessible data. For that, it is possible to extract opinions from different audiences according to the sampling of the databases. They're also able to predict trends and scenarios. Social listening actions, especially in data society, are essential for actors, such as the state, to verify how important information has been socially interpreted in the control of epidemics. What are the demands of society and how to communicate with people? And it is necessary, I repeat, that the sender takes responsibility for the ways in which his speeches have been interpreted, because the responsibility for the communication lies with the one who communicates. We cannot avoid this. We cannot say, oh, I'm not responsible for what you're listening. I'm not responsible for what you understand of what I'm saying. We cannot say that. It is essential, therefore, that there is not only social listening, but governance in social listening in the management of epidemics, including the infodemics that usually accompany health epidemics. This type of action does not violate data protection and privacy laws, and it is important that these limits are respected. Second, the very trauma of the COVID-19 pandemic has shown that individuals need the collective. We need each other a lot. And the collective also needs individual contributions to follow the route of the common good, enriching itself from the plurality of visions and demands. From the point of view of the ideals of personal fulfillment, Potter already said that the individual finds personal fulfillment when he acts beyond himself, in the construction of something greater, the common good. In the same vein, arguing about happiness based on neuroscience studies, The Buddhist monk, Matteo Ricard, that is said to be the happiest man in the world, and he laughs at that all the time, declares that empathy and altruism have transformative power over the individual, acting positively in his personal fulfillment. Thus, the defense of the collectivity can be based on individual benefits, a language that our population understands more easily. Sad to say that, but that's it. Therefore, individual and collective do not necessarily contradict each other. They can be enhanced by each other. And in the face of extreme challenges that are on the way, the very existence of both is under threat if these concepts do not find a common place of possibilities. Apparently, the path is not mostly about producing more and more laws. Yes, we do need to improve our internet legal framework in Brazil and in other countries, but it will not solve the problem without a greater change. Returning to the apparent ethical legal conflict with which I began this exposition, Brazil already has a general law for the protection of personal data on one hand. On the other, we have a beautiful constitution that managed to focus on the social goals, even in the face of classical individual rights such as private property. And at the same time, this constitution guarantees rights to people against the state. In other words, it is already in our constitution that defending the collective does not automatically imply the suppression of individual rights, but perhaps even the opposite, their empowerment on new moral basis, and this new moral basis that I think that we have to talk about. And there's where we need to go, the development of our common morality. Technology has taken unthinkable leaps in recent years. Cities have grown, information travels the world at breakneck speed, environmental problems have worsened, we are writing more and more specific legislation, but we are properly prepared for the future? Again, I'm not just talking about adapting bridges and roads to new rainfall regimes arising from new climate extremes, but are we morally prepared? Does our common morality underlie the contents of the message that need to be passed to the population in this scenario? And does it find an echo in people's ears and hearts? As to social listening, the issue is greater than just having technology to extract anonymized data with respect to individual rights and produce reports to support public decisions. The biggest challenges, basically, are the following. Are we really prepared to listen, to active listening? And are we taking responsibility as communicators for our communication? That is, for the recipient's understanding and interpretation of what we say. If you didn't understand quite well what I'm trying to say here, I have an image to give as an example. When a bird sings, for the bird, maybe he's only telling the other bird that he's hungry. But we, the recipients, look at that and say, oh, music, beautiful music of that bird. The bird is not singing music. I am the recipient. I understand that as a music. The same when, a guy is on his drums. For him, that is music. He has the intention to do music. But then someone else in the street say, oh, that's a lot of noise. So the recipient understand that as noise. The guy that is making the music has the intention to make music, but to the recipient, that's noise. And so the message is, where is the message? The message is in the recipient. The message is in the recipient. So that's what I'm saying. You cannot just say, oh, I'll say whatever I want. The other one will understand whatever I want. The message is not complete if we talk like that, because the message is on the recipient and we have to take responsibility on that. Well, we have certainty about the future scenarios, including that scenarios, the serious pandemics will occur with increasing frequency and that the Earth's climate is warming. While we are still unable to solve even the profound social inequalities that have dragged on throughout human history. Author has championed bioethics, the ethic of survival, for over 50 years. What the next 50 years be like if we don't use knowledge about how to use knowledge for the common good? if we don't have necessary reason to update our common morality to the challenges of the present. I suggest, therefore, that we not only think about the technology of extracting social listening data or the new necessary legislation, but firstly, that we think deeply about transforming the values that underlie our communication and our actions in the face of major health threats. The bridge to the future, that's a Potter's term, is not only built by science, but also by the humanities, above all by ethics, the permanent thinking about our own ideas. Thank you. 谢谢，多谢。
Thank you so much, Chair. Sorry about the rush. Thank you for finishing the talk so speedily. Our next speaker is one of us, Machado from Hong Kong. He's a native of Brazil. He completed his LLB in Brazil, and then his LLM in Ottawa, and then his PhD in Oxford, and now he's in Hong Kong. So you're going to tell us a lot about the world and how governance of social listening could be designed and constructed on that basis. Thank you.
All right. Thank you very much.
We'll do that. Yeah. Thank you. Yeah. Thanks.
I'll try my best to keep within the 10 minutes or
More than 10 minutes.
roughly a bit more. All right. So you've heard some negative ideas, right? About not the ideas themselves. You heard about some negative facts from Brazil, right? I'm here on a panel about Brazil, so I need to frame my presentation a bit around Brazil, even if it's about law and politics in the governance of tech platforms. I'm going to be focusing here on a Brazilian issue. It's a different issue. It's like Brazil is undergoing a difficult time, right? At least has undergone a difficult time during the Bolsonaro government, but it's like before everything else was perfect, right? And like in earlier governments, and the history of the internet in Brazil is a democratic history. We tend to think of Brazil as a positive country, right? We tend to think of Brazil as a happy country and as a place of democracy and of inspiration, a large democracy. And the history of the internet of Brazil, in a way, intertwines with the history of the internet in the world, which emerges as well, invested in the same spirit of a democratic message, a message of participation, a message of a bottom-up participation and of individual empowerment. And in a way, the presentation, what I'm going to highlight here is how the origins of the internet, but of the regulation of the internet in Brazil mirrors movements, global movements that have brought us to the present state of disarray. How the internet is right now, the questions we're dealing with, the online harms we're grappling with are a consequence of how we have failed to attend to common values, issues of common good that were so well highlighted in the previous presentation. So Brazil, internet and democracy. Just a brief history of the internet in Brazil. Brazil came from the 80s, the dictatorship in the 80s, right? Until the 80s. We underwent a very cruel dictatorship from the 60s to the 80s, right? The 80s in Brazil were still, even after the dictatorship, a moment of a more hands-on approach by the state. The state was more interventive. From then on, things started to change, right? And started to change, mirroring global changes as well, with the emergence of the internet, with the emergence of expectations of social participation. Brazil was a pioneer in this sense. The 90s gave us the Brazilian Internet Steering Committee, which was the first multi-stakeholder committee for the making of decisions concerning internet infrastructure. Brazil was a model for other countries. Before other countries, it adopted a participatory institutional framework for making decisions about the internet as a collective resource. In the 2000s, we had, So this is the page of the Brazilian Internet Steering Committee. The 2000s were a moment in which Brazil was very much favoring a culture of open source, peer-to-peer culture. The Brazilian government was very much involved with this, the promotion of free software, a very idealistic moment of the internet in Brazil. That guy at the bottom, Gilberto, the other one, the less important one, Gilberto Gil, who won several Latin American Grammys, was then the Minister of Culture, and he was an amazing Minister of Culture, and he's a very influential personality, musically as well as politically in Brazil. And then in 2010, right, in the 2010s, we had the Marco Civil, the internet, the internet, the Brazilian Internet Bill of Rights. Brazil was the first country globally to adopt a Bill of Rights. A Bill of Rights reflecting ideas of individual empowerment, of autonomy, but also framed very much in an individualistic ethos that I'm going to unpack in the sequence. The 2020s gave us Bolsonaro, right? So that seems to be the root of all of our problems, right? So what is Marco Civil? Marco Civil was the Brazilian Internet Bill of Rights, still the main framework in Brazil for the regulation of the internet. Now we have a data protection law on top of Marco Civil, besides Marco Civil creating a framework for the protection of personal data. But Marco Civil is the framework that sets the principles for the governance of the internet in Brazil. It was the first Internet Bill of Rights, and in a way it is a paradigm, and it reflects many common ideas about regulation of the internet, but it also, and this is my claim, reflects many problems of how we approach the governance of the internet and things that have been changing in the intervening years since Marco Civil was approved. In a way, Marco Civil, when it was enacted in 2014, it already came to reflect expectations that were not nurtured by the international community anymore. Marco Civil was enacted in 2014, and it mirrored provisions like yesterday Jason was mentioning, Section 230 of the Communications Decency Act in the US, right, which was adopted in 1996, which is a very problematic provision. And we came to reflect that again in Marco Civil in 2014, like 20 years later, without reflecting on the problems that were already present in the original Communications Decency Act provision. So Marco Civil comes late into the game to reflect ideas that were already starting to be abandoned within the international community, within the academic specialized literature. Those ideas were not so endorsed anymore. And came to reflect expectations even that were never adopted in the extreme ways they eventually were adopted in Brazil in Marco Civil. Marco Civil came to be a landmark for these expectations. Marco, if you translate literally, right, is like a landmark. Marco Civil is the civil landmark. But more than a landmark, Marco Civil became a memorial of ideas that were starting to abandon. And what were these ideas? So Marco Civil came as a paradigm to reflect these ideals, which were ideals of a certain purity of the internet. The internet as something to be preserved, something that should be framed in that way, in that particular way, and that we shouldn't admit being changed into something else. There was something that was inherently good on the internet that it was conceived originally and that we should endeavor to promote. That was not unique to Brazil. that was the trajectory followed by most countries internationally. Ideas that the internet was a space of freedom, freedom of the mind. Those the original scholars who approached issues of internet law, they reflected this more a bit anarchist way of thinking about the internet. But this way of thinking about the internet, and this is what I'm going to argue in the sequence, which will be a short sequence, paved the way for contradictions that are now coming to the fore. I don't know whether you are familiar with Bruno Latour's We Have Never Been Modern, right? But he has that image, right? The works of purification and the works of translation, which to me is very powerful, that we're seeking to purify issues, and at the end, we are just giving birth to hybrids, isn't it? Giving birth to hybrids. And that's what happened with the internet. This idealized image that we had of it prevented us from seeing what was really going on. And that is what happened in Brazil in 2014, so late. And that remains as an image because that is the main framework there right now, which is at the root of many problems like Bolsonaro coming into power in the way he came, misinformation as it is, as we see it, right? Being enabled by an internet that we cannot regulate. So Marcos Seville reflects common underpinnings of a way of thinking of the internet that are paradigmatically present there. I'm being signaled that I have 1 minute left. I'll try my best to finish within 1 minute. I thought I had a little bit more. So what we see in Marcos Seville is an expectation of neutrality, if I can say it like that. It's an expectation that decisions won't be made by any actors, be it private actors, be it the state. The individual should be empowered to make his own decisions. Marcos Seville reflects an idea of technological diffusion, of technology as something inherently good, something that should be promoted. And the state has this role of promoting technology, of optimizing the network infrastructure in ways that diffuses new technologies and modes of use and access. Even courts are restrained by Marcos Seville, as we're going to see. The core provisions of Marcos Seville, which mirrors Section 230 in the Communications Decency Act. This provision entails that providers of internet services, right, platforms, they shouldn't be held liable for content that they host, unless except after a court has told them to take the content down. Until then, they don't respond, even if they know, because the expectation is that the platforms are not going to be making the decisions, that the individuals should be making the decisions. But it goes beyond that. Marcos Seville makes it difficult even for the courts themselves to take the content down, because it says that the courts need to specify the specific place to define the specific place where the content is located. The URL, this was interpreted as being. So that means that for misinformation, for instance, how do you deal with that? Because the court cannot take it down for the future. Each new instance of content that comes up, then the court needs to determine that specific instance of the content being taken down. So Marcos Seville reflected this idea of individual empowerment and of disempowerment of state actors and of private actors as well. Telecom providers of internet access, there is an idea of network neutrality, which is shared by many countries, but which in Brazil was adopted in an extreme form. Only purely technical, indispensable technical decisions could be made by internet access providers, meaning that they shouldn't be making decisions at all in terms of content, in terms of value. The expectation of autonomy in an exacerbated way, right? Reflecting the individualistic ethos of neutrality. So these are the two core provisions. The immunity provision, which I just mentioned, which the court order, you see in the paragraph 1 there, the court order must include clear identification of the specific content identified as infringing. That is a tragedy for misinformation. How do we deal with the problem? How do we deal with the problem? And then the net neutrality provision, which goes a bit beyond our scope, right? But only technical requirements indispensable to the adequate provision of services can be taken into account by internet access providers in moderating access to content. So these provisions are on the verge of being abandoned because of different reasons. There are constitutionality challenges. The net neutrality provision has been remarkably attenuated by regulators who adopted a different understanding about neutrality, saying that that telco providers, they can make decisions for business purposes, for instance, in the context of zero rating, which enables people to access Facebook and Twitter, right? Which was just mentioned in the previous presentation. So what we can say that in Brazil, we are going through a moment now to reflect a certain twilight of this idea of neutrality. There is an abandonment of neutrality as an ideal. So those provisions are on the verge of being abandoned. But they are on the verge of, these ideas are on the verge of being abandoned, not only in Brazil. They are on the verge of being abandoned globally. We start to speak of online harms. We start to speak of data, to have data governance framework, tackling misinformation, tackling online harms, and in very substantive ways, in ways that reflect the need for us to make decisions in terms of content, decisions in terms of value. These frameworks that are emerging are not individualistic frameworks in a way that they speak of societal harms. They speak of state intervention, right, to curb societal harms. The Digital Services Act in Europe, for instance, it speaks of systemic risks involving social issues, involving issues of morality, involving political issues. Misinformation as a political problem affecting democratic processes. The state stepping into realms that before we wouldn't admit of the state stepping into. We wouldn't see the state as justifiably being able to make decisions about value, about conceptions of the good. Right? So in practice, what we see is that there is an increasing movement towards curbing online harms, increasing regulation of online harm, and this is happening in practice. But in theory, we're still left with that image of Marco Seville. In theory, right, we're still there. So the twilight of neutrality that I'm talking about here is practical, but it's not conceptualized. It's not a theoretical twilight. We retreat in practice, we regulate harm in online flows, but in theory, we retreat to an imaginary world of unfettered information flows, from which only some societies are seen to deviate, right? The authoritarian ones, the Chinese regulating their internet, whereas the Europeans, right? I'm not one of them, but the Europeans or the Americans don't, right? The Americans don't, but the Europeans do, right? The Digital Services Act as being an example. But we remain with this doctrine of neutrality as a paralyzing doctrine, preventing an evolution of our ways of thinking and conceptualizing our practices of governance of the information environment. So just to conclude, we need to move from an idea as we speak of platforms and of regulation of platforms. We need to approach this, and it's an issue that is going to come back tomorrow, right? Of epistemic justice. We need to approach the problem of platforms as a problem of justice and as a problem of responsibility. We need to move from neutrality to responsibility, to normative responsibility, responsibility towards deciding well. When an online service provider a platform comes into contact with some form of content that is harmful, the platform needs to make a decision, needs to make a call, and to think that the platform should be encouraged not to make a call, it's just wishful thinking. So the responsibility is one of deciding well rather than refraining from making decisions. The same applies to the telecommunications service provider. It becomes an issue of reasonableness, of proportionality, rather than an issue of neutrality. So what is important is to make sense of normative standards, which in turn includes making sense of values and conceptions of the good, include engaging with morality, includes engaging with moral content, and abandoning what Stephen Weill in his Liberalism, Perfectionist and Restraint, among many other communitarian authors, speak of as the bracketing strategy, the idea of certain flavors of liberalism, that the state shouldn't be making decisions. The state shouldn't be making decisions on values and conceptions of the good. So the idea that a well-ordered information society, a well-ordered information environment is something that is beyond a purely rose and well-ordered society where we're not making decisions about these issues. We all are, all countries are. So when we think of how China handles the governance of the internet as something diametrically different from how the governance of the internet is handled in Europe, this is a total misconception. This is a total misconception. Of course, there are differences. We cannot say that there aren't differences, right? But the common theme here is the engagement with things that so far we have thought we shouldn't be engaging with, but that the reality of the internet proves us that it's impossible for us to ignore. And it's not about tracing a line in the sand, separating authoritarian countries who don't make decisions about content from liberal countries, authoritarian countries who do make decisions about content, from liberal countries who don't make decisions about country, right? As if we're speaking about two different things. What is important is discourse, is engagement, is that we try to find common grounds, right? Different cultures having a conversation, an open conversation without pointing fingers at each other. Right? And I think this is at the root of everything that we're talking about here as we deal with misinformation, as we deal with the infodemic. And it's that's why it is so nice, right, to have such a diverse audience here together talking about this issue. So that was what I had to say. I'm miserably beyond my time, but thank you very much for listening to me.
Thank you so much for bringing to us such a wonderful conclusion.